Attention Deficit Hyperactivity Disorder, or ADHD, is a mental disorder that causes both inattentive and hyperactive behavior in those affected. It is one of the most scientifically validated mental health disorders and lasts a lifetime, and it is associated with difficulties in family, academic, social, and occupational situations. It is most commonly diagnosed in childhood to adolescence. However, some people are not diagnosed until adulthood. ADHD has a variety of potential causes. These causes largely fall into two main groups: genetic and environmental. Genetics play a major role in the development of ADHD, with 20% to 30% of children with ADHD also having a family member affected. Environmental factors also contribute and often work in conjunction with genetic factors. Environmental factors can include psychosocial, such as family relationships and prenatal exposure to drugs or alcohol, dietary, as well as exposure to toxins such as lead. ADHD is a highly prevalent mental health disorder. School-age children and adults alike are affected by it. Approximately 3 to 10% of school-age children and 2 to 7% of adults are affected. Worldwide, approximately 5.3% of people have ADHD. It is diagnosed at a 3 times higher rate in boys than in girls. However, everyone affected by ADHD is affected regardless of socioeconomic status, race, or ethnic group. There are a variety of subtypes of ADHD. The inattentive and distractible subtype is a type of ADHD characterized predominantly by inattention and distractibility without hyperactivity. The impulsive, hyperactive subtype is the least common type of ADHD and is characterized by impulsive and hyperactive behaviors without inattention and distractibility. The combined type is the most common and is characterized by impulsive and hyperactive behaviors as well as inattention and distractibility. Symptoms of ADHD differ from person to person, depending on their subtype. Individuals in the inattentive subtype often display difficulty maintaining attention, listening, finishing tasks, and noticing details, while those in the hyperactive impulsive subtype display difficulty sitting still, playing quietly, waiting in lines, as well as may find themselves frequently on the go. As stated previously, the combined subtype is the most common, and it has symptoms from both of the other two subtypes. ADHD often presents itself differently between boys and girls, with boys displaying more symptoms from the hyperactive impulsive subtype, while girls present more symptoms from the inattentive subtype. As this implies, boys tend to show much more obvious and disruptive behavior than girls. This results in a much higher rate of ADHD intervention in boys. While co-occurring disorders are common in both boys and girls, disorders in girls tend to be more internalized, while disorders in boys tend to be more overt. Diagnosis of ADHD is split into two stages: assessment and diagnosis. The assessment stage requires both a face-to-face interview with the individual, along with side reports from multiple sources, including family members, teachers, and other third parties. The diagnosis stage uses the DSM-5 diagnosis tool to determine if the individual is displaying ADHD. Using this tool, an individual diagnosed with ADHD must display 6 of the 9 main symptoms, with those symptoms persisting for at least 6 months. There are a variety of intervention options for those with ADHD. For educational accommodations, individual education plans, or IEPs, are used in order to aid the individual in having success in their education. The most common form of intervention is medication. The most often prescribed medications are methylphenidate, or the name brand Ritalin, and Adderall. These drugs work to stimulate the central nervous system and ease the symptoms of ADHD. Therapies are also an effective option on both an individual and family level. These help with understanding how to live with ADHD and develop strategies that work with their diagnosis. Thank you for watching, and for more information, please visit yourlearner.com.